Radiotherapy is X-ray treatment, so to all intents and purposes, if you are a patient, it feels as though you're just getting an X-ray. So the important thing about that is that it's completely painless. So that's the most important thing to point out. You don't see anything, you don't feel anything. But we're using X-rays, and because the X-rays are doing a bit more than taking a picture, they're a bit stronger. You still don't feel anything, you still don't see anything, but they're actually treating the tumour. So occasionally for these types of cancers, we will treat you with some radiation treatment, but it's very straightforward to deliver. It means coming up to the cancer centre. It's pretty much always done as an outpatient, so you don't even need to be admitted to hospital, and we try and manage any side effects that the treatment might cause, and we usually manage them very well. Occasionally patients might feel a little bit sick on treatment, but we can manage that with anti-sickness drugs, but otherwise it's very simple. You come up, the radiotherapy is planned, we do that using some CT scans, and then when the radiotherapy is being delivered, you go to a special room that we keep down in the basement where the radiographers will help you, and they will plan and deliver the treatment for you. It takes about 10 or 15 minutes, and it usually is given between Mondays to Fridays, sometimes over a couple of weeks, sometimes a little bit longer, just depending on what needs to be done.
The patient will come to the treatment area, which is this unit here. We've got a linear accelerator, and this is a normal CT scanner, but it's for our verification to ensure the patients are on the right position. They'll lay down on our couch in the same position where they were scanned 2 weeks ago, and we'll set up to some permanent marks that were put on during that time. Either once a week or every day, depending on the patient's setup, they'll get a verification scan, and this is matched against the scan they had 2 weeks prior. Any adjustments in the patient position that's needed will be carried out from there, and then the treatment unit will deliver the treatment. It can take approximately maybe between 2 to 5 minutes to deliver the treatment. You can't see anything or feel anything. It's just a buzzing noise when they're laying on the bed. They are in the room on their own when they're having the treatment, but there's cameras that watch them all the time, and we're just behind a door that protects us from the radiation. So this is the treatment unit. It moves around the patient in a arc-like way. The bed will move up so the unit can get underneath as well. This is an imaging panel, so we use this to check people's positions along with the CT scanner to check the position as well. So at Newcastle we have a diagnostic CT scanner to help us with our patient verification, and the couch that's under the treatment unit can spin round 180 degrees to go into the CT scanner. Then the images will match up with the scan 2 weeks ago, and we'll carry out the moves, spin the bed back round for the treatment. Not all treatment units require one of these. Some have imaging on board, which can do the same thing as the machine moves round. It just really depends what unit you put on, but they all deliver the same treatment. So when patients come for treatment, they probably won't notice that they get any side effects for a few days, maybe up to a week and a half. As they go along the treatment, the side effects will build up. We're mainly concerned about the skin in the area. They need to look after that well and apply cream on maybe once or twice a day. Drink plenty of water because they can get a bit tired. Other than that, they might just find that they get a little bit of something called cystitis, which is agitation in the bladder, and possibly a bit of loose bowels, diarrhoea towards the end of the treatment. But we tend to monitor them weekly, and they'll be given medication from the doctor if that's required.